Leh, in Ladakh, the land of llamas, and a remote district of Jammu and Kashmir, surrounded by snowy mountain peaks. Despite the difficult terrain and high-altitude rough weather conditions at 12,000 feet, the content faces of people here say that life does not give them much reason to complain. But not always. Sometimes there are lines of worry on their foreheads. Life has taken a serious bend for this 14-year-old boy Wangchuk. He has been suffering from severe back pain for the last 15 days. Not able to walk, he was taken to Sonam Narbo Memorial Hospital, SNM, the only one in Leh. Doctors examine him. X-rays are required. As Dr. Ringchuk pensively looks at the X-ray, he knows that the case is complicated, and he needs an expert opinion on this case. He can't do it on the phone, as he also needs to show the X-ray, which is essential to form an opinion. And without an expert opinion on this case, he hardly sees any hope for his poor patient who cannot afford to go to any big hospital. Thousands of kilometers away at Chamrajnagar, a remote township of Karnataka, a different story unfolds. 54-year-old Mahadeva has been sweating and suffering from severe chest pain for the last 10 hours. His only hope, the district hospital at Chamrajnagar. Dr. Niranjan examines the patient and asks for an ECG. He needs to consult a cardiologist immediately. The nearest place he can think of is Narayana Hrudayalaya in Bangalore. And Dr. Niranjan knows that time is crucial, and if he wants to save Mahadeva's life, he has to save time. At Saragur, another remote tribal village of Karnataka, Vivekananda Memorial Hospital remains the only ray of hope for people here. Satya, a 60-year-old tribal complaining of cough and breathlessness, has not been able to pass urine. Dr. Rajendra Prasad takes serious note of Satya's symptoms. Expert advice is needed. While all cases vary from each other in time, distance, and nature of the disease, they are united in one respect. The doctors can adopt similar means to solve the crisis. The solution is heaven sent, literally. Welcome to the world of telemedicine. The computers in the SNM hospital in Leh are connected to the best of the medical hospitals through the satellites provided by the Indian Space Research Organization ISRO. This vital link helps the doctor at this hospital to transfer all the vital data of a patient from X-rays to ECGs for an expert opinion, and also to establish a two-way communication through video conferencing. Let's see what Dr. Ringchuk is going to do. Sitting in front of the computer, he sets the camera placed over the monitor, gives certain commands, and waits for a few seconds. A video conferencing link is set up between SNM Hospital in Leh and Amrita Institute of Medical Sciences, or AIMS, Cochin. And the poor patient of Dr. Ringchuk, for whom getting the expert opinion from a specialized hospital in the south of India would have been next to impossible, is being examined by the same.
He is having severe backache with the stiffness of the back for about 1.5 months.
Okay. Can I just see him stand, please? Okay, could you just make him stand? That's right.
Yeah, he is standing. He can't stand properly. He is standing with the support on the thigh, both thighs. And his back
okay, he's holding his thighs with both his hands, is it?
Yeah, he is putting weight on the knees and There is no any sort of action on the spine. It is just it is like a bamboo.
I can see that the spine is very stiff.
Yeah.
He is actually bending his hip and knee.
Yeah.
He is not bending his spine at all.
Not all. Yeah.
It could be a congenital past defect which is only aggravated
Right.
following the injury. Both are possible.
Right.
Can you also tell me what treatment he has had? So far you said he is slightly better.
Some sort of antibiotic in the form of this ciprofloxacin. I give him the postural changes, then the movements in the leg.
The glittering eyes of Dr. Ringchuk say it all. He knows that sooner or later, Wangchuk will be able to stand on his feet once again. Meanwhile, at District Hospital, Chamarajanagar in Karnataka, Dr. Niranjan has already switched on the vital link with Narayana Hrudayalaya in Bangalore.
Here we have got one patient, sir. Mahadeva, 54 years old male from Chamarajanagar, sir. He complains of chest pain since evening 4 p.m. sir. Compressing type associated with sweating and pain radiation, sir. He was a known diabetic and hypertensive last 5 years, occasional alcoholic and non-smoker, sir. On examination, he has got pulse of 70 per minute, BP of 150 by 100 mmHg and heart rate of 70 per minute, sir. His cardiovascular system examination S1, S2 present, sir. Then respiratory system normal, sir. No creps, sir.
What's your working diagnosis with the investigations you've done, doctor?
Sir, we have taken one online ECG that was showing ST depressions in V1 and V2, sir, and upright T waves in V1, V2 and upright R waves in V1, V2, sir. So I suspect it's as a posterior wall MI.
No, he still has got any chest pain?
He has got chest pain, sir. Ongoing chest pain continuous.
Dr. Niranjan,
Tell me, sir.
I agree with your this diagnosis of unstable angina, query positive wall MI because of the P waves in V1 and V2.
Sir, if the serial ECGs and enzyme changes goes in favor of posterior wall MI, what are the treatment we can give, sir?
You have to put him on aspirin, clopidogrel, beta blockers like Betalock 50 BID.
Okay, sir.
Then give him injection low molecular vitaparin,
Okay, sir.
0.6 ml twice daily subcutaneously. And you can give him ACE inhibitor. You can put him on atorvastatin 20 milligram once daily.
Okay, sir.
And start him on intravenous nitroglycerin
Okay,
through
sir.
infusion.
Okay, sir.
Once the pain is subsided, you can start him on oral nitrates.
Okay, sir.
And if the pain continues, you can put him on nicorandil 5 milligram twice daily.
Okay, sir.
And if the situation warrants, you should thrombolyze him at a later time when you feel it is fit. You can contact us anytime he has got any aggravation of the pain.
Okay, sir.
Mahadeva looks on, unable to make out anything of the conversation. The face of the doctor from Narayana Hrudayalaya is a big solace to him. Deep within, he is convinced that now he is out of danger.
In association with the Indian Space Research Organization, we created a chain of coronary care units in remote locations of the country, like Tripura or Chamarajanagar or Siliguri, Bankura and various northeastern hill states and tribal belts of the Karnataka state. And these telemedicine units offer services like high technology heart care. When somebody develops a heart attack, he can come to this coronary care unit, and we offer the entire coronary care unit services from remote location.
And today, efforts are on to replicate the success story of Leh in the remotest parts of the country. Kargil, its difficult terrain and rough weather make the life of the patients and doctors in this only hospital much more challenging. But the installation of the telemedicine facilities being imminent, the doctors here are quite hopeful.
Telemedicine, I would say, is something which is required for Kargil. It's something very unique for Kargil. It is a boon for the patients and the doctors of this place,
When it comes to telemedicine facility, it is also welcome in relatively less remote hospitals of Jammu and Kashmir, like Sher-e-Kashmir Hospital in Srinagar, Medical College Hospital, Jammu, and District Hospital in Katwa. The reason is simple. The expectation in the eyes of the patients who travel miles to come here in search of one thing: hope. If it is the doctors of Cochin for discussing the complications in the spinal injury patient in Leh, it is an academic discussion with Dr. Subhani in AIIMS in Delhi about the finer aspects of medical facilities available in SNM Hospital Leh. While doctors in Leh are busy interacting, thousands of kilometers away down south, the technology of telemedicine unfolds itself with another healing touch. This time, it is Dr. Raghvendra of Arakonda Village Hospital, the senior cardiac surgeon of Indraprastha Apollo Hospital in New Delhi. Dr. Ashwini Kumar Bhalla about his patient Akhilesh, a young boy who suffers from a blockage in his heart valve. The concept may sound simple, but the challenges are manifold. Soon, the best medical consultancy in India would just be a few clicks away, bridging the gap between two diverse points located anywhere on its 3.2 million square kilometer area. And the only gap it would widen up in the process is between life and death. For a country as vast and diverse as India, where quality healthcare is still not accessible to millions, telemedicine seems to be crucial. Today, telemedicine is being looked upon by the Government of India as an important scientific and technological tool to bring quality healthcare to the doorsteps of those who can't even think of it.